One of the most common condition patients come to our clinic with complaints of, and from which millions of people throughout the world are suffering from, is back pain. Let's talk about it. We are going to dive deep into what causes back pain and how can we treat back pain, and what changes can we do in our lifestyle to stay away from back pain or lower back pain. Welcome to my channel Zen Spine. I'm Dr. Rakesh Dhake. I'm a consultant spine surgeon working in Mumbai. Now, to understand what causes lower back pain, let's look at it from what our habits or behaviors are that contribute to the conditions which cause back pain. For example, if I tell you a disc prolapse causes back pain, but why did the disc prolapse in its first place? What did we do or what did we not do for us to have a disc prolapse? So let's first understand what habits can cause spine problems which can then cause back pain. So if you look at, there is a particular cause or some pattern to it that these patients do or don't do which causes them to have back pain. The first and the foremost is prolonged sitting. It is also said that sitting is new smoking. Why do they say so? Because prolonged sitting, what it does to your spine is, if you understand the basic anatomy, spine is composed of multiple vertebrae or bony blocks which are separated by cushions or the discs. Now, if the pressure that we put on the discs when you sit is roughly around 25 units when you are flat or when you're not loading your spine, when gravity is not acting, when your body weight is not acting, at that time the pressure on the discs, the intervertebral disc, is around 25 units. That can go up to as high as 275 units when you are sitting. So when you are sitting for prolonged duration of time, you are subjecting your discs to so much of pressure constantly for like hours and hours of desk job, and hence IT professionals or any desk job which involves prolonged sitting are more prone to have disc related problems. The other condition is overweight. Now, if someone has higher body mass, obviously the spine has to do more work to keep you upright. So more the weight, more the stresses or more the forces on the spine to help you stand straight and be straight. So if you lose a few kilos, definitely your spine is going to be happy and will thank you and reward you with a pain-free back. So yes, if your weight is on higher side, you need to lose weight. The third most common thing that can predispose to spine related problems or can cause spine related problems is improper lifting, which means also improper bending or arching your back. So when you have to lift something from the floor, you shouldn't be bending down by arching your back, but you should have your back very straight, stiff and firm, and bend in your hips and knees so that your back is not arched. So if this is how your bending or lifting is done at like regular activities or even when you're working out at the gym, you should make sure that your back is straight, and if it is straight, then you're less likely to have disc related problems. But if you're repeatedly doing this improperly by an arched back, you are very likely to have a disc prolapse in years or days or weeks to come. Also, another thing that can contribute to back pain is smoking. So what smoking does to you is, the chemicals that are released when you smoke has a very negative impact on healing of the discs. So if you have disc related problems, smoking is definitely not going to help you, but it is going to harm you in a way that the disc won't heal and the problems of back pain will still persist or worsen. Hence, if you have back related issues, you have to stop smoking. So now, looking at all these conditions or habits or behaviors that contribute to disc related or back related problems, let's look at what are the pathological problems that are caused in the spine or seen on the MRI scan or on X-rays or CT scans. These problems we'll discuss one by one, and then how do we treat it in the next section of the video. So the first and the foremost and the commonest spine problem is disc disease or degenerative disc disease. Now what disc disease means is, there are various stages through which a disc goes. It could be just a disc bulge, it could be prolapse, it could be herniation, it could be sequestration, it could be extrusion. So all these names are given to the various stages of disc bulges. So if you look at the basic anatomy of the disc, a disc is composed of a central gelatinous material which is enclosed in a thick capsule which is called annulus fibrosus. So what happens is, when you load this disc repeatedly to pressure or inappropriate forces like I mentioned bending or arching your back, this soft center gelatinous material can pop out through the annulus or the capsule of the disc and can dislodge a fragment which then can press on the nerves. So even if there is a tear in the annulus or the capsule of the disc, that itself is very painful, which is called annular tear. So ranging from annular tear to disc sequestration or extrusion, there can be various stages depending on how bad is the bulge. All these problems can definitely cause back pain, and if then this fragment which is popped out is pressing on your nerves, then you can have pain down your legs. So the next stage is, along with this disc, if there is hypertrophy or increase in the size of the joints and ligaments, it causes lumbar stenosis, which is the next condition, commonest condition in back pain. So lumbar stenosis, what it does is, along with back pain, because it also presses on your nerves, these patients also have pain down their legs. So along with back pain, they have leg pain, they need to stop after walking for some time. But yes, lumbar stenosis can also cause back pain. Now, other common cause of back pain is instability in the joints or spondylolisthesis. What listhesis means is there's a slippage of one vertebra on top of other. Like L4, for example, is the commonest, which slips on L5. Now that slippage could be because of the break in the parts, or the posterior part or the backside of the vertebra can break, and because of that there's a slippage of one vertebra on top of other. Now what this does is, when you sit, when you stand, when you roll in bed, when you change positions, all these positions are painful. Hence, it causes mechanical localized low back pain. Now, if this also impinges on the nerves, yes, these patients may have pain down their legs. So these 3-4 conditions are the commonest conditions in the spine that can cause back pain. Along with this, there are rare conditions like an infection due to tuberculosis, the commonest cause in India, or it could be any infection like bacterial infection in the spine, which can eat up the bone, cause instability, can cause pus formation, abscess formation, which can cause back pain. The other rare condition is tumor. It could be primary spinal tumor, or it could be tumor from elsewhere that has spread to the spine and is eating up the bones and is causing instability and therefore back pain. These are the conditions that we find in the X-rays that can cause back pain. Now, how do we treat this condition? Let's understand the treatment part of back pain. Now, when the patient comes to us with minimal problem in the MRI scan, which is like disc bulge or like stenosis, which is not so bad, we usually focus on non-surgical treatment options, which is like giving them medicines, not painkiller for long, but like nerve-related medicines, some multivitamins, calcium, vitamin D supplementation. Along with that, we focus on strengthening their core and back muscles through physiotherapists, who need to work one-to-one with the patient and understand what are their problems and then focus on them to help them strengthen their paraspinal muscles and therefore get rid of back pain. Now, please understand here that physiotherapy is very, very crucial if you have back-related problems, along with doing changes in your habits or behaviors or your lifestyle that we earlier discussed. All these things need to be changed, which means you should not be sitting more than 30-40 minutes at one place at a stretch. You should take intermittent breaks. You should sit, stand, do some stretches, then you can continue your work back again. You should not lift anything heavy from the floor, and if you are, you should make sure that your form is good. You're not arching your back, you're bending in your hips and knees. Other thing is, if you are on a heavier side, you need to lose weight. So all these things you need to do side by side as you are taking medicines and doing physiotherapy. Otherwise, this is not going to help you. Medicines are not going to help you. Physio is not going to help you. So if you have back problem once, you will have to do this for the rest of your life, making sure that you are not arching your back, you're not building up weight, you are not smoking, you should quit smoking. So all these tiny things are going to make the difference in long run. Now, if medicines and physio have not helped and you continue to have back pain along with some leg pain, then injection might be the right choice for you, where we inject a mixture of local anesthetic and tiny amount of steroids very close to the nerve which is getting pinched, and that can give you pain relief to quite some days, weeks or months. We don't know how long it's going to last, but it will give you a pain-free window which we use to focus the physiotherapy exercises on you, help you reduce weight, change your lifestyle, encourage you to have a healthy lifestyle, and all these differences then help you to ease your back pain. And meanwhile, if the disc bulge is soft, it's fresh, it's acute, it might recover on its own. The purpose of the injection is to give you that pain-free window and help that acute inflammation or acute episode to settle down. Now, if you have failed all these treatment options, which is medicines, physio, injections and you continue to have pain, or if you have weakness or loss of sensation or neurodeficit or involvement of bowel and bladder, then surgery is the last option for you, wherein we go close to the nerve, we release them, we free them from compression. If there's a disc fragment, we remove it. If there is instability, we fix it. If there is infection, we take biopsy and then treat it with antibiotics. If there's a tumor, then depends on what tumor it is. So then we treat the underlying cause when all other non-surgical options have failed. And if you need surgery and it is even well done and you're better after surgery, it does not mean the story is over here. You still need to take care for the rest of your life so that the other segments in the spine stay healthy. So that is the treatment part of back pain. Now, having talked about what lifestyle changes, what habits, behavior contributes to back pain, what are the pathologies and how do we treat them, I hope this video has given you quite an insight about what back pain is and how do we treat it. So if you still have any questions that have not been answered in this video, please do not hesitate to write in the comment section below and we'll try our best to get back to you as we get time. You can also WhatsApp us on the number given in the description below and we'll get back to you as we get time. But please WhatsApp from 9 a.m. to 9 p.m. and do not call on the WhatsApp. Please do a normal call on the number given below in the above mentioned timings and we'll try our best to get back to you and help you as much as we can. But please understand, we cannot keep chatting to you on WhatsApp. When you need a video consultation, we'll advise you to have a video consultation to understand your problem personally and how do we treat it. If you like this video or gain any information, please do not forget to subscribe to our channel and like this video. I'll come up with more such topics on spine related issues and we'll try our best to help you and help the spine community as much as I can. Thank you so much.